My name is Eric Hofstay. I am one of the clinical IPAC coordinators with the Southeast IPAC Hub team. I will be presenting our COVID-19 vaccine education PowerPoint material for you. Please click on the audio indicator on each slide to listen to the related speaking notes. The Southeast IPAC Hub is committed to improving infection prevention and control practices in all congregate settings within the Southeast region. This includes conversations and education around COVID-19 vaccination. This education module was reviewed by a panel of local experts and partners who support the use of this module for education. In addition to public health measures that may be in place and healthy habits to help limit transmission, the COVID-19 vaccine is the most effective way to prevent COVID-19 infection. This module will provide you standardized education with the most accurate and up-to-date information you need to make an informed decision regarding COVID-19 vaccination. This learning module was created in response to the Minister's directive requiring long-term care homes to develop a COVID-19 vaccination policy, including COVID-19 vaccination education program. Recently, Ontario's Chief Medical Officer of Health has implemented Directive Number 6, requiring COVID-19 vaccination policies for hospitals, home and community services, local health integration networks, and ambulance services. Additional high-risk settings will be required to implement similar policies in the near future. This education module will be useful for anyone who has questions around COVID-19 vaccinations. If you have been fully vaccinated or have a medical exemption, you may not be required to complete this learning module. However, the information provided will still be beneficial and informative. If you are unsure or have decided not to be vaccinated, this learning module must be completed to ensure you are making an informed decision. COVID-19 vaccination, like all vaccines, helps keep us, our families, friends, co-workers, residents, clients, patients, and our community safe. By the end of this module, you should be able to answer the following questions. What is COVID-19? What are the benefits of COVID-19 vaccination, and do they work? What are the types of COVID-19 vaccines available, and how do they work? Are COVID-19 vaccines safe? What are common side effects of COVID-19 vaccines? And what can I expect before, during, and after immunization? To date, over 209 million people have been infected with COVID-19, with nearly 5 million deaths, making COVID-19 a now vaccine-preventable disease among the leading causes of death globally. In Ontario, almost 600,000 people have been infected, and we are now approaching 10,000 COVID-19 deaths. To see real-time global information, visit the Johns Hopkins University COVID-19 dashboard, or click the links to your local public health region. COVID-19 does not just impact older people. As older individuals get vaccinated, and with a highly transmissible COVID-19 variants of concern on the rise, the demographic of those impacted by COVID-19 is now younger adults and children, some who are ending up in intensive care, requiring life-supporting interventions. The COVID-19 death rate is 8 to 10 times higher than with seasonal influenza. The variants of concern lead to 4 times higher increased risk of ICU admission and double your risk of death. We can't predict who may experience the most serious complications or long-term post-COVID conditions. Even after recovery from COVID-19, post-COVID-19 conditions pose a wide range of new, returning, or ongoing health problems people can experience more than 4 weeks after first being infected. We are seeing struggles with memory, difficulty thinking or concentrating, fatigue, body aches, heart and lung damage that are lasting for weeks to months and can happen to anyone who has had COVID-19, even if the illness was mild or they had no symptoms. Like any disease, especially COVID-19, which we are trying to control, we see a strain on our healthcare system with delays in surgeries and hospitals operating at or above capacity, not to mention the public health measures put in place to help limit transmission that impacts our daily lives. Everyone who gets COVID-19 gets it from somebody else. If you get it, you may be fortunate and have a mild case, but what may be minor for you could be devastating for someone you pass it on to. COVID-19 is a disease caused by a virus called SARS-CoV-2 that was first recognized in 2019. Most people with COVID-19 have mild symptoms, but some people can become severely ill and require intensive care and life-supporting interventions. Although most people with COVID-19 get better within weeks of illness, some people experience post-COVID conditions or complications. These include a wide range of new, returning, or ongoing health problems people may experience more than 4 weeks after first being infected with the virus that causes COVID-19. Generally, older people and those who have certain underlying medical conditions are more likely to get severely ill from COVID-19, although individuals of all ages are at risk of severe illness and experiencing long-term post-COVID health conditions. Variants are viruses that have changed or mutated, and is expected to happen. Variants are common with all coronaviruses. However, a variant becomes a variant of concern when its changes have a clinical or public health significance that affects one or more of the following: transmissibility, or how easily the virus can be spread; virulence, or the severity of the COVID-19 infection; vaccine effectiveness, or how well the vaccine prevents illness; diagnostic testing, such as the ability to test or surveil for infection. There are currently 4 variants of COVID-19 that are a concern to public health. They are commonly referred to as alpha, beta, gamma, and delta variants respectively. Delta is now the most dominant strain, accounting for more than 90% of all new COVID-19 cases in Ontario. Studies are ongoing to determine the effectiveness of the current authorized vaccines against these variants, but research is promising. Most vaccines are proving to be effective against emerging variants, especially when people are fully vaccinated. It's important to remember that no vaccine is ever 100% effective. Symptoms of COVID-19 can vary from person to person. They may also vary in different age groups. The most common symptoms are a fever, dry cough, either new or worsening chronic cough, shortness of breath or difficulty breathing, and tiredness or weakness. Other symptoms that are less common but may affect some people include a sore throat, runny nose or nasal congestion, headache or dizziness, the loss of taste or smell, conjunctivitis or eye redness, gastrointestinal symptoms such as abdominal pain, diarrhea, or vomiting, and different types of skin rashes. Children tend to have more abdominal symptoms and skin changes or rashes. Symptoms can take up to 14 days to appear after an exposure to COVID-19. Remember, if you have these symptoms, you should self-isolate and be tested for COVID-19 and potentially other respiratory pathogens. SARS-CoV-2, the virus that causes COVID-19, is transmitted or spread most frequently and easily at short range from an infected person to others through respiratory particles when an infected person coughs, sneezes, sings, shouts, or talks, mainly through close contact from people who are physically near each other, generally within 2 meters. The respiratory particles vary in size and can be large droplets that fall to the ground rapidly, within seconds or minutes, near the infected person, to smaller droplets, sometimes called aerosols, which linger in the air under specific circumstances, such as aerosol-generating medical procedures. COVID-19 spreads very easily from person to person. How easily a virus spreads can vary. The virus that causes COVID-19 appears to spread more efficiently than influenza, but not as efficiently as measles, which is among the most contagious viruses known to affect people. Infectious droplets or aerosols may come into direct contact with the mucous membrane of another person's nose, mouth, or eyes, or they may be inhaled into their nose, mouth, airways, and lungs. The virus may also spread when a person touches another person through a handshake or a surface or an object, such as a railing or door handle, which has the virus on it, and then touches their mouth, nose, or eyes with unwashed hands. We know that the virus is most frequently transmitted when people are in close contact with others who are infected with the virus, either with or without symptoms. We also know that most transmission occurs indoors and in poorly ventilated spaces. Research around COVID-19 transmission is ongoing. There is no evidence at this time that the virus is able to transmit over long distances through the air, for example, from room to room through air ducts. It is still unclear how easily the virus spreads through contact with surfaces or objects. The number of days between when you are infected and when you may develop symptoms is known as the incubation period and can range up to 14 days for COVID-19. The average incubation period is between 5 to 6 days from exposure to symptom onset, with most people developing symptoms within 11.5 days of exposure, but can take up to 14 days. The time that you're considered contagious or infectious to others is also known as the period of communicability. A person may be contagious or infectious around 2 days or 48 hours before showing symptoms and can remain infectious for 8 to 10 days after symptom onset, being the most infectious around the start of their symptoms. People infected with COVID-19 can spread the disease to others while they have symptoms and sometimes before they know they have symptoms. We call this pre-symptomatic. People can also be without symptoms. This is known as asymptomatic. To prevent transmission, some basic and common infection prevention and control measures you should take into consideration at all times are general healthy habits, such as cleaning your hands often, especially before touching your eyes, nose, or mouth, and after blowing your nose, coughing, or sneezing. You can sanitize with alcohol-based hand rub or wash your hands with soap and water. You should be practicing respiratory etiquette by coughing or sneezing into your elbow or into tissues and cleaning your hands after. You should avoid touching your eyes, nose, and mouth, especially with unclean, dirty hands. Always stay home if you are sick. What you think may not be a big deal could make someone critically ill, and of course, stay away from people who are sick. Always follow any public health guidelines that are in place, such as physical distancing, mask use, avoiding crowded spaces, and limiting social interactions. We want to break the chain of infection. Control the portal of entry and exit by washing your hands often, using respiratory etiquette, avoid touching your eyes, nose, and mouth, and most importantly, reduce your risk of being a susceptible host by getting your COVID-19 vaccine. There are many benefits to vaccination for ourselves, our loved ones, our residents, patients, and our community. Vaccination reduces your risks of becoming infected with COVID-19 even after one dose. Vaccination will also significantly reduce the severity of your illness if you are infected with COVID-19. Vaccination also helps achieve community immunity, or herd immunity, within our population. No vaccine will ever be an 100% guarantee, but it is our best defense to protect ourselves and everyone around us. Your vaccination might stop COVID-19 from reaching someone who would not survive it, like someone you provide care for, or a friend or family member. Every choice we make right now either increases or decreases risks to ourselves and everyone we come in contact with, and everyone they'll come in contact with. By protecting ourselves, we are protecting the people we care for. Elderly and immunocompromised people and those with comorbidities have the highest risk of developing serious illness and dying. Being vaccinated can greatly decrease the risk to this population and help to limit transmission. The vaccines currently approved for use in Canada have been shown in clinical trials to be 70 to 95% effective at preventing even mild infection with COVID-19. More importantly, they are nearly 100% effective at preventing hospitalization and death from COVID-19. Countries who are able to begin vaccination in 2020 show a dramatic decrease in hospitalizations related to COVID-19, despite the easing of public health restrictions. In Ontario, the evidence of increased vaccination was clear in long-term care homes from January to April 2021, with over 90% resident vaccination and 55% of staff vaccination at that time. As you can see, active COVID-19 cases from January 13th to April 5th, 2021 dropped by 99.5% in residents and 91.2% with staff, clearly demonstrating the effects of vaccination and community immunity at work in long-term care homes across Ontario. As of May 30th, 2021, it is estimated that across Ontario, 97% of long-term care residents are fully immunized, and more than 89% of staff have received at least their first dose, with approximately 66% fully immunized. These two images show COVID-19 daily case counts for Ontario and long-term care homes. The top image in yellow shows COVID-19 daily case counts in Ontario from April 24, 2020 until June 8, 2021, with waves 2 and 3 clearly evident. The image below represents active daily cases in long-term care homes. The red is residents, and the black line is staff for the same time period. As you can see, at the end of wave 2, long-term care home active cases continued a downward trend due to an increase in vaccinations. In long-term care, there was no third wave, as you can see, compared to active cases in Ontario's general population. The data supporting vaccinations is becoming more apparent in our general population, not just in long-term care homes, as the vaccination rates continue to increase and the fourth wave affects mostly unvaccinated individuals. The evidence is clear that the rate of COVID-19 in unvaccinated individuals is higher compared to fully vaccinated individuals. Those who are unvaccinated are approximately 8.1 times more likely to become a case of COVID-19 compared to those who are fully vaccinated. As you can see in the graph, unvaccinated cases in yellow accounted for the majority of COVID-19 cases, 95.2% reported since December 14, 2020 and up to August 7, 2021, with fully vaccinated cases in blue accounting for only 0.6% or 2,455 individual cases out of 9,320,603 fully vaccinated individuals as of August 7, 2021. Similar trends are observed for hospitalizations and death, with unvaccinated cases in yellow accounting for 92.5% of hospitalizations and 92.1% of deaths, and fully vaccinated cases in blue accounting for 0.8% of hospitalizations and 1.2% of deaths. Immunization is widely recognized as one of the greatest public health achievements of the 20th century. Vaccines save lives, prevent the spread of diseases, and reduce healthcare costs. Immunization programs are an important foundation of Ontario's healthcare system. This poster compares the number of cases of 6 vaccine-preventable diseases in Canada before and since the introduction of vaccines. It is interesting to compare the then cases to the now case, and note that polio has 0 cases now, which is due to the benefits of vaccination programs. When community immunity is compromised by vaccine hesitancy or outright refusal, we see clusters and even epidemics of these vaccine-preventable diseases, even in developed countries like Canada, the USA, and in Europe. Let's take a closer look at COVID-19 vaccines. Vaccination is a simple, safe, and effective way of protecting people against harmful diseases before they come into contact with them. It uses your body's natural defenses to build resistance to specific infections and makes your immune system stronger. Vaccines train your immune system to create antibodies, just as it does when it's exposed to a disease. However, because vaccines contain only killed or weakened forms of germs, like viruses or bacteria, they do not cause the disease or put you at risk of its complications. Most vaccines are given by an injection, but some can be given orally, by mouth, or sprayed into your nose. Vaccines reduce risks of getting a disease by working with your body's natural defenses to build protection. When you get a vaccine, your immune system responds to it. It recognizes the invading germ, such as the bacteria or virus, and produces antibodies. These antibodies are proteins produced naturally by the immune system to fight disease. Your body's antibodies remembers the disease and how to fight it. If you are exposed to them again in the future, your immune system can quickly destroy it before you become sick. The vaccine is therefore a safe and clever way to produce an immune response in the body without causing the actual illness from the disease. Our immune systems are designed to remember. Once exposed to one or more doses of a vaccine, we typically remain protected against the disease for months to years, decades, or even a lifetime with some vaccines. This is what makes vaccines so effective. Rather than treating a disease after it occurs, vaccines prevent us in the first place from getting sick. Click on the video or the box to view a short video and learn more. Only vaccines that are proven to be safe, effective, and of high quality are authorized for use in Canada. The first vaccine available is your best bet at preventing COVID-19 infection. All currently authorized and recommended COVID-19 vaccines are safe, effective, and reduce your risk of severe illness. We will now look into viral vector and mRNA vaccines in a bit more detail, including videos from Dr. Julian Poliquin, Acting Vice President of Canada's National Microbiology Laboratory. As discussed in the video, viral vector vaccines use a modified version of a different virus, the vector, to deliver important instructions to our cells. The cell then displays the COVID-19 spike protein on its surface, and our immune system recognizes the spike protein, which triggers an immune response. Our bodies are then prepared to protect us from future COVID-19 exposures. As discussed in the video, mRNA COVID-19 vaccines teach our cells how to make a protein or a piece of the protein. The cell displays the protein piece on its surface. Our immune system recognizes the spike protein and begins building an immune response. Our bodies are now prepared to protect from future COVID-19 exposures. These are some common myths about COVID-19 vaccines. In general, it is not possible to get COVID-19 from a COVID-19 vaccine. There is no live virus. Vaccines do not affect our DNA in any way, as they never enter the cell nucleus. Viral vector vaccines do not cause an infection with COVID-19 or the vector virus that is used in the vaccine. mRNA vaccines do not enter the part of the cell that contains our DNA, also known as the cell nucleus. mRNA vaccines do not remain in our system as the cells break down and get rid of the mRNA as soon as it's done using it, leaving the COVID-19 spike protein on the cell surface. All steps to evaluate standards of safety, efficacy, and quality were met in the approval process for the COVID-19 vaccines. As of August 6, 2021, over 50 million doses of the COVID-19 vaccine have been administered across Canada alone, and over 4.7 billion doses have been administered worldwide. In Canada, only 3,063 serious side effects were reported. That means a serious adverse event rate of 0.006%. In Ontario, almost 20 million doses have been administered, with only 536 serious side effects reported. That is far safer than commonly used medications like Advil and Tylenol. The vaccine was able to be created quickly because of global efforts with the world's leading scientists focused on a single task. There were essentially unlimited financial, scientific, and technological resources. No steps were skipped in the process of developing, testing, approving, and producing the COVID-19 vaccines. After getting vaccinated, it is common and normal to have temporary side effects. These can last a few hours to a few days after vaccination. This is the body's natural response, and it's working hard to build protection against the disease. Localized reactions occur at the site of the injection and can include redness, soreness, and swelling at the injection site. Reactions can also be felt throughout different parts of the body. These are known as systemic reactions and can include mild fever, chills, headache, fatigue, muscle and joint aches, or pain. The most common side effects reported from the COVID-19 vaccine are fatigue, headache, muscle aches, mild fever and/or chills, which occurred during the first week after vaccination, but were most commonly reported 1 to 2 days after receiving the vaccine. Serious allergic reactions are rare, but do occur. They include anaphylaxis, which has been reported 155 times for all COVID-19 vaccines given across Canada. That's 50 million doses. This rate is consistent with other commonly administered vaccines, like the flu shot or shingles vaccine, and is much lower than the rate of anaphylaxis to common medications like penicillin. There have been some reports of blood clots related to a specific COVID-19 vaccine made by AstraZeneca. This is very rare and estimated to occur between 1 in 55,000 to 1 in 500,000 people. Compare this to the incidence of blood clots after flights that are greater than 4 hours, which is 1 in 4,655. Also, getting infected with COVID-19 increases the risk of blood clots to as high as 1 in 5 in hospitalized patients with COVID-19. Myocarditis, or heart inflammation, reported data is not yet available nationally. However, in Ontario, 246 cases have been reported out of 20 million vaccines and has only been attributed to mRNA vaccines. Myocarditis cases often go away without notice or complications. Serious reactions following immunization should be reported to a healthcare provider. This information is reported and used to monitor adverse events following immunization with vaccines to ensure the continued safety of vaccines in Canada. Canada's National Advisory Committee on Immunization recommends if you have a severe allergic reaction, such as anaphylaxis, after getting your first dose of a COVID-19 vaccine, you should not get a subsequent dose of a similar type of COVID-19 vaccine. You should talk to your primary care provider to see if another type of COVID-19 vaccine would be a good idea for you. Before receiving the vaccine, talk to your healthcare provider or clinic staff if you are currently feeling unwell or have signs and symptoms of COVID-19. If you have had a previous allergic reaction to a COVID-19 vaccine or any ingredients in the COVID vaccines or other vaccines. If you have allergies or allergic conditions. If you are immunocompromised due to disease or treatment or have been diagnosed with an autoimmune condition. If you have a bleeding disorder or are taking medications that could affect blood clotting, as this information will help the healthcare provider or clinic staff prevent bleeding or bruising from the needle at the time of vaccination. And if you've received any other vaccines, including the COVID-19 vaccine, in the last 14 days. You can still get your vaccine if you are pregnant or breastfeeding, but you should talk to your healthcare provider if you have any concerns or questions. Not all of these reasons mean that you should not get your COVID vaccine, but you should talk to your healthcare provider about the recommendation they provide for you based on your known or reported health history. It may be more appropriate for you to delay your vaccine based on their recommendations at the time. The fear of vaccinations is commonly thought of as an issue that only affects children. However, the fear of vaccinations affects many people of different ages for varying reasons. The good news is there are strategies to consider that can help reduce fear, stress, and anxiety that is either related to the needle, receiving an immunization, or being in a healthcare setting. Communication is extremely important. When a healthcare provider better understands any barriers to immunization, they can ensure they are providing the best support, such as providing additional time to support, allowing time for deep breathing exercises, distraction techniques, or listening to music, reading, or watching videos. Or maybe you need someone to just keep talking to you. Let the healthcare provider know. Topical anesthetics, commonly called numbing creams, can be applied prior to immunization. It is a good idea to talk to your pharmacist or healthcare provider about the proper time to apply the cream before receiving an immunization, the proper location of application for the best effect. Have your questions answered before your appointment so you know what to expect and have a plan. This will make you feel more comfortable by being better prepared and in control. Once you have your plan and have thought about what strategies will work for you, remember these tips for a comfortable vaccination experience. Sit upright during vaccination. Wear a loose-fitting top that is short sleeve and can roll up easily over the shoulder, or the neck of the top can easily drop down over the shoulder. Keep your arm as relaxed as possible, so the muscle is relaxed and your arm is loose like a spaghetti noodle. Use deep breathing exercises to keep your body relaxed, and if you feel dizzy or faint, tell someone right away to ensure you're in a safe position. Distract yourself with reading or listening to music or continuing conversation. Talk to your healthcare provider ahead of time about medication recommendations for pain relief and any discomfort following immunization. You can take medication after your vaccination to help with any pain or manage any symptoms. If you have concerns or questions, always ask your healthcare provider what they recommend to manage your symptoms. You can also apply a clean, cool, wet cloth or compress over the injection site to help reduce any discomfort associated with pain or swelling at the site. Keep your arm moving, but don't overexert with strenuous exercise or overuse. Drink plenty of fluids to maintain hydration, which can also help with some symptoms such as a headache. Although most people will not have significant side effects, some people may consider scheduling their vaccination so they are home if they have any concerns about not feeling well the next day. It is essential that everyone continues to follow any public health measures that are in place to help stop the spread of COVID-19 in our communities. As more vaccines are given, some of those more restrictive public health measures may be lifted. You won't develop significant protection against COVID-19 until about 2 weeks after you get vaccinated. And remember that for the 2-dose COVID-19 vaccines, the second dose of the vaccine is needed for the greatest overall protection. It is important to continue to follow public health measures following immunization until we reach effective community immunity and vaccine targets to help lower the risk of spread and transmission in our communities. Remember that personal protective equipment is still required when providing direct care and must be worn as indicated. COVID-19 is not the only infectious organism around. The COVID-19 vaccines help protect you from getting sick with COVID-19 if you are exposed to the virus. They also help in reducing the spread to others if you become infected and spread it to family, friends, co-workers that might not survive the COVID-19 infection. Getting your vaccine is an important step in ending the pandemic. It is safe and effective. We can already see the impact of vaccination in long-term care homes and in our general population. In the first 2 waves, the elderly were impacted more with the virus, but this has changed significantly during the 3rd wave. Those over 75 accounted for few cases, and the majority of the infections happened among younger ages without broad access to COVID-19 vaccines. It's becoming clear that getting vaccinated will be the key to returning to many of the things we miss the most. Please consider getting the vaccine. Protect yourself, your family, and help bring back whatever it is that you've missed over this past year. And now, Dr. Supra Sharma, Chief Medical Advisor for Health Canada, on her reasons for being vaccinated. Delaying or choosing not to be vaccinated means you are risking the following: your health, as you have an increased risk of severe illness and death. Additionally, you may develop a long-term post-COVID-19 condition. The health of others, as you may unintentionally pass COVID-19 to someone who may not survive, such as friends, family, co-workers, and those you provide care to. The health of your community, as decreased vaccination rates will lower community immunity and put your community at risk. A delay in the return to normal. With the continued risk of COVID-19 transmission, there is an increased likelihood of additional COVID-19 waves and the social and economic impacts of public health measures used to control transmission or spread. We hope this COVID-19 vaccine education module has provided details to help provide clarification, answer questions, and provide you with information based on evidence and research to help you make an informed decision about your COVID-19 vaccination. The decision is yours to make. It is important to have your questions answered and review additional information if you still have concerns or questions in order for you to make a decision that is best for you. If you have further questions, use reliable sources of health information, such as the resources listed near the end of this presentation. You can also consider talking to a trusted and well-informed healthcare professional. Thank you for your attention, and consider the important role of vaccination to protect yourself, family, and your community in which you live and work. The choice is yours. What do you choose?